Welcome to our YouTube channel, Back in Balance. I'm Dr. Tina Schaffner, a doctor of physical therapy at Neil King Physical Therapy. Today, I'm here to answer some frequently asked questions about physical therapy. We get many of them across our 10 locations in the Metro Detroit area. The first one to answer today is, what types of conditions do physical therapists treat? We treat a variety of conditions, including musculoskeletal injuries of the neck, back, shoulder, jaw, feet, and hand. We treat conditions after someone has had a surgery, whether it's a back surgery, ankle surgery, once again, neck surgery. We treat other chronic conditions such as fibromyalgia, chronic arthritis, and lymphedema. In addition, we also treat some other specialty conditions that include men's and women's pelvic health, pediatric conditions of torticollis or developmental delay. Another common question is whether or not you need a physician referral to see physical therapy. There can be some confusion in that word referral. Right now, we're going to use it to mean a script, which is the piece of paper that the physician hands you when they advise you to go to physical therapy. In the state of Michigan, we have direct access. However, unfortunately, there are some limits. As a physical therapist, we can treat your condition for 10 visits or 3 weeks, whichever comes first. In all cases, we can complete an evaluation. We can then take that document that we create, which is called a plan of care, and send that to your physician with the findings from that evaluation. Assuming that your physician will sign that, that becomes a prescription. So there's one of two ways. Either the doctor hands you the piece of paper, or we complete an evaluation here and send that to your physician and wait for it to be signed. In both cases, we have a limitation of 10 visits or 3 weeks. Now, assuming that you want this to be paid for by insurance, we do need that prescription ultimately signed in order to bill insurance. There are a few insurance companies that will allow you to see a physical therapist without a prescription. However, that is your responsibility as the patient to first reach out to your insurance company and make sure that you know their regulations. Will my insurance cover physical therapy? Most insurance plans, including Medicare and Medicaid, typically cover physical therapy. However, coverage can vary based on your plan, the number of allowed visits, your diagnosis. It's a good idea to check with your insurance provider for details on copays, deductibles, and coverage limits. We do our best here at Neil King Physical Therapy to explain those nuances of your insurance to you, but ultimately, as the patient, it is a good idea for you to check with your insurance company about the fine details of your plan and how it covers your physical therapy. How long does physical therapy take? The length of physical therapy varies depending on your conditions, your goals, how well you progress, what condition you come in, and where you want to end up. Some people may need just a few sessions over a few weeks, while others with more complex issues, post-surgical recovery, especially neurologic conditions, may require several months or longer of therapy. Another factor to consider is who's paying for the therapy services. If you are using insurance, we have a third party that we must prove medical necessity in order to continue to treat, which means we are constantly showing that you are making progress towards your end goals. The other alternative is to pay cash for services. That may afford you a little bit longer length of stay because you're the one that dictates how long you stay and what the end goal looks like. What does a typical physical therapy session involve? Well, that depends. The first day will always include a thorough evaluation. And at Neil King Physical Therapy, that is something that we get complimented on all the time. We take the time at that first session to listen to all of your questions and concerns. From there, we move on to all the strength testing, flexibility, joint mobilization, joint testing, special tests, and all the things that we learn in physical therapy school to make sure that we can find all the problems that you have that are holding you back from reaching your goals. Included in that session is also going to be some treatment. We're going to start education that day on posture, movement mechanics, and give you some things that you can help to work on that pain management when you leave that first day, so that you can start the healing process from the very first session. Every session after that is definitely tailored to the findings from that evaluation. So we're gonna build on the strengthening exercises, we're gonna build on the flexibility and the things that you can do at home that then supplement the manual hands-on work that we do in the clinic. We are with you side by side through your entire session. You'll be with a skilled, licensed clinician the entire time. We use our hands, our different techniques, and our different strategies that then offer you the affordance to go home and move forward. Here at Neil King Physical Therapy, we are by your side for your entire session. You will be with a licensed, skilled clinician the entire time. And so we'll make sure that you're using all these exercises appropriately and moving towards your goals. What should I wear to physical therapy? That's a great question. Your best bet is always to have a variety of things with you. If you're coming for your knee or you're coming for your shoulder, chances are we're going to want to have access to those parts, meaning tank tops for women, taking shirts off for men, so that we can do a hands-on-hand treatment session. We do our best work when our skin touches your skin and we can get a better feel for what's going on in those tissues. I also recommend that you wear supportive shoes. Oftentimes you get patients who will present in slides or loose-fitting sandals. While that might be okay for one visit, if we're asking you to remove your shoes, it won't be okay for further visits when we're asking you to move around, possibly doing some different agility work. It's always best to wear loose-fitting clothing. It'll provide us for the widest variety of options to do that skin-on-skin manual therapy care and also get the best viewpoint of your joints during your movement work. Is physical therapy painful? Physical therapy should not be painful in general, but sometimes there is discomfort that may occur as you begin to move muscles and joints, things that have been injured and mobile. Don't be surprised if you come in after a total knee replacement or a shoulder surgery or some of these other surgeries where you have been pretty still, that there is discomfort after we start getting those joints moving. No pain, no gain is not something that I subscribe to, nor do any of the therapists at Neil King Physical Therapy. We do our best to ensure that you're as comfortable as possible. We can adjust our treatment techniques, the position that you're set up in, to your tolerance. We try to keep an eye on your tells. Are you wincing? Are you holding your breath? And some patients have none. Our goal is never to cause tension in one area, just in the efforts to alleviate tension for the reason that you're coming in. It is so important to communicate to your therapist about any pain or what's happening during your session. Which also means, should you cancel a session because you're in pain? No. If you can safely transport yourself to the clinic, then by all means, come to therapy on those days. We get live data from that session that we can see what works best to immediately resolve your pain issues and then help you take that information home. So if this happens on the weekend or a time when we're not available, you have something that you can do to help address that pain. What happens if physical therapy doesn't work? That's kind of a loaded question. If you're not feeling progress, your therapist reassesses typically every 4 weeks to see if the therapy and the treatments that they've been doing, along with the exercises that they've given you at home, are working towards meeting your goals. What does progress look like? Well, from an objective standpoint, which is what the insurance companies look at, it means that you've increased your range of motion, you've increased your strength, you're moving better. That doesn't always correlate with your pain. So we have to make sure that we're monitoring both of those issues. Now, when the plan doesn't work according to how we as therapists think it should or you as a patient should, sometimes we will request other imaging, x-rays, MRIs, or actually referring you to a specialist. The goal is to find the best solution for your needs, and we'll work with you every step of the way. Can physical therapy help me avoid surgery? In many cases, yes. Physical therapy can be an effective alternative to surgery, particularly for those musculoskeletal conditions like tendonitis, spinal pain, herniated discs, or even joint pain. By strengthening the muscles, improving mobility, and addressing those underlying movement conditions and how you use your body as a machine, we can help avoid surgery. However, there are cases that I've had where the patients come in for evaluations and that joint, especially in the cases of shoulders, knees, and hips, just is too worn and that you actually will need surgery. We will help you through that process along the way. There are also cases where we know that a patient may need an MRI. However, insurance won't cover it unless you've done some length of physical therapy first, and we are used to help justify the needs of that advanced imaging like MRIs and x-rays. Why choose Neil King Physical Therapy? I'll be honest, I think I'm biased. It's the best clinic in the Metro Detroit area. Neil has invested so much money and resources into the education and advancing of his clinicians, you can't go wrong. We offer such a variety of treatment approaches, including rolfing, craniosacral, pelvic floor dysfunction, lymphedema, and the list just goes on. We can treat so many conditions at this clinic, which means that we've got a great toolbox to handle the issues that you're coming in for. Another good reason is we really give specialized attention. It's almost like Cheers. You're gonna come in and everyone's gonna know your name from the time that you walk in the door. You get a friendly smile and your clinician stays with you the entire time for your visit. There will be no setting you on a bike and running away, maybe to use the restroom, and that's about it. In addition, we're gonna be able to hold your hand and take you through all of your exercises to make sure that you are doing everything the way you're supposed to be doing it. The last reason, you will always be treated by a licensed clinician. We have a variety of physical therapists and physical therapist assistants, but everyone's licensed. Now, because of that education that Neil has given us, we provide a holistic approach. I've heard that patients will come in from other clinics and say, well, I went in with shoulder pain and they just looked at my shoulder. Your shoulder isn't something that's isolated from the rest of your body. We're gonna look at your shoulder and how does that fit on your thoracic spine or upper back? And how is that working with your neck? Because there are a lot of muscles that go from your neck to your shoulder. We're also gonna look at how that addresses your low back. We're gonna look at you as a whole human being and how you work and move as a whole to address an issue that might be an elbow issue or a shoulder issue. Thank you for watching. If there are any other physical therapy related questions that you may have, please subscribe to our channel, check out our website, or please give us a call.